Hey everybody, welcome back to my blog. I wanted to make a video for you guys who have a family member or a friend going through breast cancer that are facing a double mastectomy, especially those who are facing the double mastectomy where their nipples cannot be saved. First off, I want to tell you there's a huge difference between getting your breast augmented for cosmetic reasons and getting implants put in because you've had a double mastectomy. When you're getting your breasts augmented for cosmetic reasons, the doctors have a lot of breast tissue to work with to make sure that the end result comes out looking as natural as possible, and there's no sight of rippling because of the implant itself. Well, when you are getting implants because of a double mastectomy, of course, the plastic surgeon does not have any breast tissue to work with in order to hide the rippling of the implant or to make sure that it looks exactly natural. So there is a huge difference, and a lot of people don't understand that. So there's a couple of things that people have said to me, and if you recognize this, don't feel bad, because honestly, it didn't really hit me till right now, how scary this whole process is going through a double mastectomy. But when you tell somebody, oh, you're so lucky that you don't have to have nipples because you can go without a bra and you'll never have to worry about nipping. Okay, I guess that's true. That's a cool thing. Also, oh, don't worry, men don't care about nipples. All they care about is boobs and they get excited. Well, okay. That's true. I agree with all of that, and I'm okay with it. But then I think about how different my life is going to be when I have implants, because they're not mine. They're not what I was born with. I am quite nervous about my self-image once I have them, about my confidence once I have them. This is something that I'm sure a lot of people who are facing double mastectomies where they don't get to keep their nipples feel. So instead of saying, oh, you're so lucky that you get a free boob job and you're gonna have perky boobs all the time, maybe instead tell the person, do you need anybody to listen to you about how you're feeling about the double mastectomy? Or would you like somebody to go with you to your plastic surgeon appointment if they don't have somebody like I did when I took my mom? You know, just be there to support them. Supporting somebody who has or who is going through breast cancer is really the best thing you can do. The last thing that I'm going to talk about is telling somebody who's going through a double mastectomy, oh, you're really lucky because you don't have to worry about ever having to breastfeed. You know, you'll get to use bottles, which is way easier, from what I've been told. But the person who is hearing that is thinking what the person who just said that probably doesn't know, which is chemo can cause young women to go into early menopause, which, for example, it did me. I haven't had a period since my first chemotherapy session, September 3rd, and I'm 6 weeks post chemo now, and I still haven't had a period. So that's kind of life-changing for a young woman. You know, you're not supposed to go through menopause at 32. So I feel really strange. Another thing is that people don't think about, chemo kills all fast-growing cells, good and bad. Well, what are eggs? Eggs are fast-growing cells. So chemo can potentially cause somebody to be infertile. Now, we don't know that for sure. The only way we know that for sure is after chemotherapy, when you go to the fertility doctor and you get them to check you all out and see if they can kickstart your period again, see if you have any viable eggs left. So just be careful what you say to people with breast cancer, because it can come across as completely different what you are meaning it to come across as. So really the best thing to do with a chemo or breast cancer patient is to be supportive, to be the person who is always there when your friend needs you or your family member needs you. So like I said, whether it's bringing dinner over one time a week or asking them if they'd like you to go with them to an appointment if they don't already have somebody to go to their appointments with them. If it's picking them up or dropping them off at their appointments, like now, during my chemo sessions and my hormone treatment sessions, I'm not allowed to have anybody with me because of Corona, but you can have somebody pick you up and drop you off. So it's little things like that that are really more supportive and more helpful to breast cancer patients than telling them how lucky they are that they get new boobs, because their whole life is about to change. Their whole self-image is about to change. So just be sensitive about that. That's really all I had for today, and I didn't want to be so melodramatic, but I felt like it was something that needed to be said. And I feel like it'll be helpful for people who have friends and family members that may have just been diagnosed with breast cancer or with any other cancer. But anywho, signing off. Let's leave it with a smile. Let's leave it with something nice. So I hope everybody has a fantastic day, and I will see you guys at my next video. If you have anything you'd like me to talk about, please mention it and I will definitely make a video on it, or I'll talk to you about it, whatever you like. So we'll see you soon. Bye.